Hi, this is Kelly Connor from Boise State School of Nursing. I wanted to show you today about an app that was designed for Android products to be able to document maternity nursing assessments and concepts to get better use of how these concepts actually work in practice and to be able to understand them better. So what this app has, it has some select labor documentation, postpartum documentation, a brief flashcard, vocabulary flashcard component, some discussion questions, and also a link to our website. Here's a screenshot of the postpartum documentation component. It's on a phone emulator, not an actual phone. It's on my computer, but it works the exact same way. This app works better on a phone. On a tablet, it depends on the quality of tablet that you're using as far as the picture quality is, but it all works the same actual way. The student can populate this top information, or you can have it pre-populated with patient name, date of birth, allergies, due date, and the GTPAL obstetric system. Then as students are going through their assessment, they would select, say, infant feeding. We have selected both, but let's say they're breastfeeding. So we hit select and let's do breast. Okay, we agree that soft, diverted, intact. Let's look at fundus. Where's the fundus at? The fundus is firm, and the location is at the umbilicus. And then we can go through lochia, and we can do a preeclampsia assessment. It's a very focused assessment, just looking at key postpartum documentation pieces, so students can really think about that piece of the assessment rather than the complete head to toe, and they can get working on what types of questions that they have. After this is all populated in the case study or the scenario, then they can bring that into the debriefing room or whatever area you're using to talk over what the students documented, what they found, what questions they have, and how this kind of fits together in a realistic setting. When the home button is clicked, it'll take you back to the main screen, but data isn't saved. And the reason I did it that way is so that this app can't be taken into a real hospital setting and used with actual clients. Okay, so here's the labor documentation piece, and it works the same way as the postpartum piece, where the student or the faculty or SimTech could enter all the information, the key demographic information for the patient. And then the student would either be given, if they had an option for electronic fetal heart rate that goes with the scenario, they could use that to document with. Or if you're doing a case study and you just had pictures of fetal heart rate tracings, this could be used as well. What we'd be looking at is the fetal heart rate components to be able to better understand what we're talking about, what we've been talking about in class, and how they relate to the patient setting. Contractions, the students would actually enter the frequency, the duration, and select for intensity. Amniotic fluid is another thing that we're going to be looking at with are they intact, are they ruptured, how are they ruptured, what was the color, what was the amount. The cervix exam would be another key component. And then if there are other important things, we would do a focus note for additional information.
Okay, this is the vocabulary component of this app. So here we are with the GTPAL obstetric documentation system. The student would click definition, and so this would tell you the definition. They could hit next and go through another fetal monitor and go through that. This I really saw as something that was more for fun. Maybe if a student was waiting around or something like that, that they could just kind of look through. There are I'd say about 20 words that they may look at, and it's just something that would be more for fun. Finally, here is our discussion questions that may be useful for the student to go through by themselves if they were working on a case study, or if you wanted to, you could use them to help guide a case study or a simulation debriefing, just things for you to think about. So generic questions like, based on your assessment, what are the most important findings for this patient and why? Based on your assessment, what should the nurse do for this patient? What do you expect to have happen? And what should the nurse do to follow up with patient care? I hope you find this app useful. If you do use this app, please send me feedback. You can get that from the Google Play site, my email address. I'd love to hear your thoughts on this. I look at this as a pilot, and I look forward to hearing with you. Thanks, and have a great day.